But there was one part that I didn't really hear being discussed, because a lot of people are taking the compounded version not just because they cannot get the FDA manufactured version. They're taking it because economically it's not feasible for them to pay for the manufactured version. Because a lot of people, it's not about the fact that it's not available. It's a fact that their insurance company will not approve it, and they have to pay out of pocket. Hello. This is Lifestyle for Living. So the big news that came out this week was that Eli Lilly was going to have Mounjaro and Zepbound taken off of the FDA shortage list. And as of yesterday, Saturday, August 2nd, there was an update made to the FDA Shortage Database website. What I really did find interesting, though, was when I typed in Tirzepatide into the FDA search, it was still showing that Tirzepatide injections are still in shortage. However, when I clicked the link, it took me to Eli's updated list that's showing now that both Mounjaro and Zepbound are available. But look here, the status is still showing currently in shortage. So there's two things that's happening here. FDA relies on manufacturers to self-report, which is what Eli Lilly has done. However, the good news is there is still a process that has to be followed. And I think what I'm seeing right here, the discrepancy between Eli Lilly reporting that Zepbound and Mounjaro Tirzepatide is now available and the FDA site is still showing as it is in shortage, has happened for several reasons. One could be a lag in the updates, meaning the data synchronization of what Eli Lilly is reporting versus what the FDA site has. There could be a delay in the FDA Drug Shortage Database as far as updating. So once Eli Lilly announced the availability, it may take some time for FDA to verify the update and update their records. So that's what we could see. And there is a verification process. The FDA may need to confirm that the supply is actually stable and sufficient to meet the demand before they officially remove it off of the shortage list. We can all attest to partial availability. Eli Lilly is now saying that they have started distributing and that Mounjaro and Zepbound and all dosages are available, but that supply still may not be sufficient to meet the entire market demand. And as a result, FDA might still consider it to be in shortage. We could have situations of regional availability, meaning the drug might be available in certain regions or for certain specific patients, but not widely enough to remove it from the shortage status. And that's some of the things that has to be taken into consideration. We have also the regulatory and administrative procedures that have to take place. So we just kind of have to take a breath and let the process go. Go through what it needs to. Eli has to report its change in the status, which is what they have done. But they also have to support by submitting sufficient documentation. And then FDA will take through the process and review it to determine if in fact it is ready to come off. We have a situation where it could be that the increased supply does not meet the guidelines or the regulatory requirements before it's considered that it can be taken off the shortage list. We can have supply chain issues, which we all can attest to some of those on the end of those who might be taking a Tirzepatide or semaglutide. Even if production has resumed, there could be delays or challenges in the distribution of the process that would prevent this Tirzepatide from reaching pharmacies and patients quickly enough. And with that, there could be issues of shipping, storage, and handling that would affect the timely availability of the drug, meaning Mounjaro and Zepbound, across different regions. The big thing here is demand versus supply. There's a high demand for Mounjaro and Zepbound, and it remains very high. So the supply might still be insufficient to meet the needs of all patients. That would prompt FDA to keep Mounjaro and Zepbound on the shortage list until it stabilizes. So One of the things that we have to kind of take a breath and realize is this is a process, and that pharmacies can also provide information to FDA on the current stock and levels of availability in local and regional markets. So the discrepancy that we may be seeing is Eli Lilly made the announcement and FDA's database is processing the announcement. And this will be processed as records are given, partial and regional availability is provided, regulatory procedures, supply chain issues, or high demand issues are addressed. So monitoring these things is something that we all have to do, and we have to seek out our health providers who can potentially provide us more information. Now, the thing is, Mounjaro and Zepbound, since they had been put on the FDA shortage list, that allowed 503B pharmacies to mass produce the compound version of tirzepatide. So when a drug comes off the FDA shortage list, the time frame within which the compound pharmacies have to stop producing that compound, there's not anything that explicitly specifies by universal regulation, and it could vary based on several factors. And I think that's something that we have to take in consideration. So there has to come out guidance from FDA and guidance from your state pharmacy boards for which way this has to go. There's a general process that typically includes following several steps. And so the good news is, while a lot of people were trying to say, okay, it's going to come off today and I'm not going to be able to get my compound, the FDA has to update its database and reflect that the drug is no longer in shortage. That's the first thing that has to happen. Then the next thing that will happen is your state board or your state pharmacy boards, they also will issue guidance and directives based on the FDA's update. So you can see this is a process. And then the people who are asking a lot of the questions is, what is the compliance deadline? When will these compounding pharmacies have to absolutely stop for enforcement? Well, that's not going to happen until it's actually taken off of the FDA shortage list. And even with that, there is a time frame that has to be put in place as to how long the compounding pharmacies have before they have to absolutely stop. Now, I did see where state pharmacy boards can include their own specific guidelines to the compounding pharmacies that they have to actually no longer produce the drug. But another thing, I think the big question a lot of us have been asking, what is the mandated specific time frame that pharmacies are expected to stop? And usually they're saying promptly, but there's nothing that specifies what is prompt. I saw a lot of information that talked about what is a reasonable period. So typically pharmacies may have as few as a couple of weeks or a couple of months. And so I saw someone else report that it was 60 days, but I think it depends on the complexity of the change and specific state regulations that also go into place. So while we're putting a lot on FDA and the website, there are state pharmacy boards that also come into place. So what the compounding pharmacy has to do is immediately review their compounding practices, and then they have to ensure that they're in compliance with federal and state regulations regarding compounding of this now drug, which was saying it's no longer in shortage. So I was really kind of concerned when I saw this, because I was thinking about what's going to happen. There also has to be notifications that's going to be put out to healthcare providers, to pharmacists, and the compounding pharmacy. So even though Eli Lilly is saying it's available, there is a process that has to take place for this drug to kind of say, okay, you can no longer compound it, and compounding Tirzepatide injections are no longer being available, and they actually have to follow certain guidelines and rules. So with all this being said, I think we had to take a good deep breath to say, okay, wait a minute, what's going to be happening here? How fast is this going to happen? And what is the game plan of what's going on? So what I'm seeing is that if Eli Lilly is successful in having Mounjaro taken off the shortage list, and FDA starts going into enforcement when they can actually monitor compliance and may issue warnings to take enforcement against any compounding pharmacy that's continuing to produce the tirzepatide compound. We're nowhere close to that right now. It's looking like this is going to be a process, and at least for another, I would pretty much say a couple of months before this actually goes into place. And then you have the situation, like I said, where your state pharmacy boards come into place, and they actually can issue what they consider to be a guidance or issue directives to pharmacies, compounding pharmacies, regarding the cessation of the compound of making the drug, meaning tirzepatide. So I was kind of on that page of trying to figure out what all would have to take place, what all the pharmacies would have to do, how quick would it happen. But so far right now, we got to hold our guns and determine which way this is going before we say pull the trigger, because like I said, there has to be patient notifications. Healthcare providers have to be informed of what's going on and that the compound is no longer available. And then we have to start saying, okay, what is the transition? What is going to be the transition? But you know what? I heard a lot of people talk about the different things that have to take place and talk about being discussed. Because a lot of people are taking the compounded version, not just because they cannot get the FDA manufactured version. They're taking it because economically it's not feasible for them to pay for the manufactured version. So I had the question that came to mind to me about, well, what about those who can't afford to pay for the FDA approved manufactured version of Zepbound and Mounjaro? Because a lot of people, it's not about the fact that it's not available. It's a fact that their insurance company will not approve it, and they have to pay out of pocket, and economically it's not feasible. So then you have to really take into consideration, what about those people? Because I've heard some people say, like me, I'm actually approved to take wegovy, which is a different version of this weight loss medication, but the same thing that's happened with Mounjaro and Zepbound can happen to me. I've heard a lot of people talk about, okay, dosage availability, and it's not going to be available. But even for those people who can say, okay, I can get it, but I can't afford it. What about those people? Why is it so much focus now on the dosage availability and not on the people who cannot afford to pay for it? And I'm really thinking in my head, one of the things I had to consider was this. Wegovy and Mounjaro and Zepbound and Ozempic, but I'm going to focus more on the weight loss versions, which is the Zepbound and the Wegovy. Insurance companies are making changes, and they're saying the criteria for authorization is changing. So even on my end, I was looking at potentially doing a compound, because I was like, okay, if I'm no longer eligible to take the manufactured approved version and I want to continue on my weight loss journey, I'm going to have to go to a compound. And yes, I've done videos that have talked about FDA approved versus FDA regulated compounding pharmacies, but there are some good compounding pharmacies who are following the rules and the guidelines. And I had to really ask myself, okay, if I am impacted by this and I can no longer be authorized to take the actual manufactured version, and my drug comes off of the actual drug shortage list, what am I going to do? And I think that's the big question a lot of people are asking is, okay, where does that leave me? And how do I do it? I was telling, so I think in one of my videos I talked about how my sister pays that $500+ and I've heard of other people doing the same thing, where her insurance company would not approve it or even partially pay for any of the drug. So she's using a coupon now to get some relief, but she's paying that $500+. There's a lot of people out here now who can't even afford that. So what is going to happen to those people who cannot afford to pay for the manufactured version, and they're seeing success in weight loss? I can't really see how this is beneficial, by saying, oh, we now have it available. Because having it available does not make it available for everyone. And that's something we got to keep in mind. One of the things I haven't seen yet, and if you've seen it, please put a link down below so we all can see it. What are the providers who are providing the compounds saying? Are they putting anything out, giving us some relief of saying, hey, if you're on the compound, this is the plan B, that if this comes off the actual shortage list, these are going to be your options that are available? I was really trying to find that. I see a lot of people in the community who are taking a compound at this time. I see a lot of them talking about it, but I'm not really hearing from the companies, meaning I use a telehealth company, and so far I've been able to be authorized and approved to take the manufactured version of the weight loss medication. But what if I'm not? And what if I'm one of those persons who did not get the authorization and I'm using a compound? I have yet to see anything posted or come out to say, hey, patrons, for your concern, this is something that we're working on. Never fear. We got this covered. You're good to go. You don't have to worry about it. We got other things in play that's going to help you when this does become in effect. So that's something that I was thinking about when I was doing this and when I was researching it, and I was seeing all the different videos that were coming out about, oh, did you hear, did you hear, did you hear? Well, I want to hear from the providers who are providing the actual compounds. I want to hear them tell us what's the next step for those who may be in a situation where they can't afford to pay for the manufactured version of the actual compound. That's something that I think is not being talked about, and I really would like to get the information on that. But back to the situation with the announcement by Eli Lilly that they were taking Mounjaro and Zepbound off of the FDA shortage list. As you can see, there is a process. So we can take a little breath and say, okay, we know we got time. And hopefully within this time frame, we'll hear some alternatives that can be done. Hopefully some prices will be lowered that people can afford it. Even like I said, with the coupon, a lot of people are still paying that $500+ because the medication is over $1,000. And these are the kind of things that has to be taken into consideration. So I just wanted to continue to talk about this, and I'll probably do some more videos on this. But if you haven't done so already, go ahead, like and subscribe, and I will keep you posted on the different processes that have to take place, and we'll see how this ends up. But let's just take a deep breath for a minute and say, let's see the process. I don't think it's going to happen immediately that compounds are going to stop, but we're going to have to see what's going to be the alternative, and hopefully we'll get some good news from the providers that are providing these compounds very soon. So talk to you later.